To give an example of the working environment, a nurse has worked 2 12-hour shifts and is coming to an end of their third 12-hour shift. To finish their shift, they decide to organize a restock of ankle distractors for tomorrow's procedures. However, an emergency bowel obstruction is brought into theaters. The already fatigued nurse must now assist with this high-stress situation, which calls for unwavering speed, precision, and concentration. This creates a perfect condition for fatigue to thrive and errors to happen. But thankfully, the case goes to plan and the patient is sent to ICU for ongoing care. However, the fatigued nurse went home, having already stayed back past their rostered shift, and forgot to organize the restock of the ankle distractors. This creates additional stress and workload for the nurses on the oncoming day. Fatigue can impact healthcare professionals in multiple ways. It is proposed that acute levels of fatigue in nurses is similar to that of diseased populations. It impairs sleep, confidence, emotional state, cognitive function, alertness, decision-making abilities, and markedly increases the risk of errors. Over time, the chronic effects of fatigue, resulting in low self-esteem, decreased job satisfaction, and workplace injury, elevate the risk of burnout amongst healthcare professionals. This often triggers a vicious cycle in which healthcare professionals decide to leave their position or take extended time off due to strain. High turnover and absenteeism place even greater burden on the remaining staff, as they must now shoulder the increased workloads and responsibilities. Combined with the already shortage of healthcare providers, this intensifies stress levels and fatigue, potentially creating a toxic and unsafe work environment. As mentioned, the impact of fatigue doesn't stop with the healthcare providers themselves. Fatigue increases the likelihood of errors for those in direct or non-direct roles, such as medication errors, surgical complications, and delays. These ultimately may compromise the patient further or unnecessarily increase the risk of adverse events that could have been prevented.
Created using Powtoon.